Good day, nurses, and welcome to How a Bill Becomes a Law, brought to you by the ONS California Advocacy Summit group. My name is Wendy Nuval-Becerra. I'm a member of the ONS California Advocacy Group, an oncology nurse, and the current president of the ONS Orange County chapter. So first things first, what is the ONS California Advocacy Group? So we are a state-based advocacy organization of oncology nurses. We formed when a group of us met each other at the 2022 ONS Capitol Hill Days in Washington, D.C. And as the California delegation, we all promised each other that we would get together when we got home and do something locally. So we did. Now each year we host the ONS California Advocacy Summit, where nurses from all over California go to Sacramento and educate our legislators on bills that we support as oncology nurses. You'll learn more about this year's Advocacy Summit later on in the presentation, including how to join. So also, as many of you may have heard, getting the emails from ONS National, that the National is currently focusing its advocacy efforts more and more on the state level. So this group is really uniquely poised to further that effort since we've been building up our advocacy efforts in California for the last 3 years. So now I would like to do some quick introductions to today's speakers. Our first speaker is Michelle Johan, who holds a doctorate in nursing practice and serves as a clinical practice education specialist at City of Hope. Dr. Johan is also a director at large with the Greater Los Angeles ONS. Our second speaker will be Celine Palmater, an experienced oncology nurse at UC San Diego Health, and she is the programs chair with San Diego ONS. Celine is also our group's policy chair and the principal author of our poster that we presented at ONS Congress in 2024. Last but not least, providing background support are Jamie Mercado, an oncology nurse at Sutter Health, and also serves as advocacy chair with Greater Sacramento ONS, and Jelani DeCastro, nursing director at City of Hope, and the current president of Greater Los Angeles ONS. Next slide, please. So as you can see, our group hails from all over California, from Southern to Central to Northern California. The best things about participating in state level advocacy is meeting all of these lovely, accomplished, inspiring nurses from all over the state of California. Now with that, I would like to turn it over to Michelle, who will introduce us to the California legislative process.
Great. Thank you so much, everyone. Wendy. So let's go ahead and start with just helpful resources. Sometimes when we think of our government and just legislative terms and just words that seem sometimes just out of our grasp because it's not something that we talk about day in and day out. You know, we know the terms of nursing, anatomy, physiology, but sometimes when it comes to legislative terms, we may not be so savvy. So what we've done is created this glossary for you. So if you use your phone, you can get access to some of those legislative terms that we'll be using tonight and that you may use in the future. Also, what we like to showcase as a helpful resource, gamification. Some of you that love to play games, well, here's one game that you can play. It's the legislative process game in which that you can scan, again, that QR code, and you can start your way and your journey through the legislative process through gamification. Okay, so let's go ahead and dive into how a bill becomes a law. Now, in California, it's very different from other states. There's different processes and different rules. So we're going to really focus on California state legislation. Now, there's two committees that make up our decision-making branches. One is the State Assembly, and the other one is the Senate. So these two committees, as you can see, are comprised of several members. They've got a term and standing committees. This is where our bill is going to originate from. But before it even starts there, it has to come up with one thing beforehand, and that is an idea. So This is a 6-step process for you to understand how a bill becomes a law. And I want you to kind of think of the things that you do day in and day out. Think of, maybe creating a garden in your backyard or a quality improvement project. You need to start with an idea. So who develops those ideas? Who comes up with those ideas? Generally, it should be the public, the constituents. It can be our senator, and it can be any member from any of those committees, but it starts with an idea. And so I want you to think of this process, the 6-step process, starting with idea first. Now, let's get into it. So anyone can decide what the idea is going to be. Anyone can bring the idea to the Legislative Council's office. You draft the idea, you can come up with anything that really affects you as a constituent or any of the members of the community. Once that idea is drafted, and you're probably thinking, well, wait a second. I have an idea. This is what I'd like to change. This is what's affecting me and my community, but I'm not too sure how to put this all together. Well, you're going to introduce it to either committee, and that committee is going to decide whether they're going to move it forward. So you want to have that legislative backup and in that review process, but it has to start in as an idea first. Then the next thing that you're going to look at is, okay, once we've got that idea, how's it going to be introduced? Well, there is a 30-day review process. So once that introduction, the bill actually is introduced, then within 24 hours, that bill is written and it becomes public. At that point, any member can review this introduction of the bill, and we can see whether it affects and how it affects community. And within that 30 days, it needs to be posted so that the public can have active view of this. So stakeholders need to understand how the implications are, and if there's enough time for our constituents to contact representatives to express their opinions, because during that introduction period, that's when people want to know what this idea is and how we want to move it forward. The next step is floor debate and committee vote. During the floor debate, this is where committees are talking. They're going toe to toe. They're discussing, how is this bill going to affect our constituents? How is that idea that started from one individual, how can it affect communities? Is there any law that can impact this bill? Is there informed consent? Is there representative? What is the outcome? And these conversations that are happening, we need them to happen because what's being discussed during this debate moment is whether this bill is going to be a good thing for the constituents or not. And then during this time too, there can be financial implications. So everybody needs to be able to discuss. So think about, like I said, you've got that garden in the backyard, you came up with the idea, you talk to your family members, those are the constituents, those are the committee members, you want to get their buy-in, and then you want to debate, what do we really need? How is it going to affect us? Is there any financial implications? And then go to the next step. That next step would be the first chamber review. Okay, we've got the idea, we introduce it, it sat there for 30 days, and then we had our discussion. Now it's going into the first chamber review. Now, during the first chamber of review, that's where where the bill was first introduced, goes back, after it's been analyzed, goes back to the original committee. So if it started in the Senator Committee, or if it started in the Assembly Bill Committee, then that's where it's going to go back to in order for it to be reviewed. So we've made all these adjustments, all these changes. Now it goes back to the House of Origin to be voted on by those members. The next step is the second chamber review. Okay, so now the members of that chamber and that committee, they're reviewing, they're looking at all the different changes. They're checking to see if, do we need to debate this further? Are there any changes that we need to make? Do we need to make adjustments? And at that point in time, it's a similar situation as the initial chamber review. But at this point, we want to make sure that it is solidified. Does that bill meet the needs? Did we make all the adjustments that we need to in order to move it to the next level and the next phase? And what is that next phase? That's when that bill is polished and ready to go to the final phase, which is our governor. And that's when the final version of the bill is sent to the governor. That means the idea was presented, it was introduced to the constituents, back and forth discussion, and it went through the different committees for review, refinement, any changes. And now that it's polished, the governor has this bill on their table, and now it is meant to be either signed and brought into law, or the governor can veto by rejecting it. Or if the governor decides to take no action at all, the bill would automatically become law in 12 days. So this is something that our governor is, they want to be ready. They want to see what's on the agenda for the bill and be able to make their action. So when we look at bills, sometimes it's good to see the history. Now, bills were first published in 1874. That's when the legislative decided the history of bills need to be documented in timeline. So it's been going on since 1874. So during this time, if you had any bill that you wanted to look at, you can look at the archive and see the history of the bill. Some ways that you can do that is through the legislative information website, which is leginfo.gov. If you scan this QR code, you can look at one of the bills that is true and dear to the nurses' hearts because it's about the nurse ratio. And this bill was first introduced in 1999. There were many hospitals and organizations that were for it and opposed it. It took several negotiations before this bill actually became a law. But if you scan that QR code, it leads you directly to that bill, and you can see the actual history of that law. So the question to you is, what is your next step?
Good evening. Thank you, Michelle. So now we're going to be talking about how we go from all that information that you just learned and how we can apply it. So education. Education information is the foundation really of learning advocacy skills. Just by joining and watching this webinar, you're already furthering your education in advocacy. If you are an ONS member, they do offer a free introductory class about legislative process and health policy advocacy. It's called ONS Advocacy 101. Also on the ONS page, they have different webinars that are past and future webinars throughout different states. They also have past advocacy podcasts. And if you go to the ONS Advocacy and Health Policy site, you can sign up for their email updates, and they email a couple of times a month with important legislative changes. They will also include like ONS's stance on those issues and then additional resources. In the next slide, we're going to talk about networking. Thanks. So networking it's a very broad term, and especially in advocacy, it can be with so many people. You could be with lobbyists, we can be with interest groups, with peers, with legislators. One easy way to kind of get your foot in is working with interest groups or professional organizations in areas that you're interested in. So like American Cancer Society, Cancer Action Network, which is very broad, all cancers. Susan G. Komen focuses on breast, PanCan with pancreatic cancer. They're usually free to join, and they provide updates regarding important issues that affect their interest areas. They also do tend to have in-person events, kind of like what we do in Sacramento, but then also nationally. So it's very easy thing to do. If you're interested, just sign up for the email. It doesn't mean you necessarily have to engage, but at least you can get that information. Another way is engaging with local policymakers. So signing up for an email list of your assembly person or your senator, attend meet and greets, anything that you can kind of get your face in, and just repetitive following, meeting with them will kind of keep you on the forefront of their mind. And then last, social media. Social media can be very daunting. It is a lot of things. And our legislators, a lot of them are on various forms of social media. It's the best way for them to get out. So just connecting with them, just following them, adding them, kind of seeing the updates. They tend to have really polished sites, and especially when they're putting like a media release out to highlight the important things that they're doing, engaging with policymakers, responding, sharing the information. Those are all simple ways. And if you don't feel comfortable engaging in social media, just follow them to get the information, see how they engage with others, follow other nurse advocates and see what they're focused on, and see how they engage with policymakers as well as other peers. And last but not least, action. So this is the most important part. I would say like the top tier. It seems very terrifying. However, engaging with your state legislators, engaging with your national legislators, they work for you. We do pay them. Our tax dollars pay them. They're very, very interested in hearing what you have to say. I know that my representatives, every time that it's the election, the first email that I get is, what is important to you? What do you want us to do? So whatever way you can, I think that that's just a nice, easy way to kind of slowly kind of step your foot in. All of our legislators tend to come back home at their home districts various times throughout the month. You can meet with them in their home office. You can also write letters in either opposition or support of legislation that impacts healthcare. And then our bread and butter, we have our ONS California Advocacy Summit. The flyer is included here with the QR code if you would like to sign up. It's a 2-day event on May 5th and 6th. The first day is learning. We're going to be hearing from a lot of fantastic speakers, learning about advocacy. And then the second day is meeting with legislators. Like I said, I know it seems very, very daunting, but our group, this is our 3rd year doing it, and we feel very comfortable. We want you to join us. We will walk you through everything that we're doing. We will go to your meetings with you. We don't want you to be scared to do this because it truly is very easy. I was terrified the very first time I met with my legislators, and it wasn't that bad. They are very, very kind. So if you have any interest, please reach out to us. Even if you don't want to sign up, but you just kind of want to ask us questions, please reach out because we would love to have you. Thank you. And then the helpful resources are back. This glossary looks fantastic. I would just say just nice thing to have. Scan it, keep it nearby, because a lot of times when you're reading through different bills or just kind of trying to wrap your head around it, just instead of having to Google every single term, it's a nice little form.
Okay, thank you. Thank you, Celine. Thank you, Michelle. Thank you to our speakers for providing us with that education. Thank you to all of you who are tuning in and educating yourself. Please keep that advocacy spark in you going, because like Celine said, we need all of your voices in this effort. The legislators want to hear from us. So something we've learned is if we don't continue to advocate and educate our elected officials, the issues that we care about as oncology nurses will unfortunately be neglected. So attend future webinars. We have a great group of nurses. Follow us on social media and join us in Sacramento. It's a great time to get involved. So thank you again for stopping by, and we hope to see you all again soon. And I'll open it up for questions.
Right, there's a comment or question in the chat. If someone is thinking about going to our advocacy summit this year, you can please email us there. That is our Gmail. It takes maybe a day or two for someone to reply. But although if you go to our social media, that is the Instagram page, and in the bio, you'll have the Eventbrite link, so you can register. If the cost itself for day one really just covers like the lunch, and we do provide food. Nurses love to get fed. So we want to make sure that you are sustained through the day. We do offer CEs as well. And so that's what that cost is for. but please reach out to us at the email or on our social media.
Any other questions?
I had a question. I just wanted to say first, thank you for this presentation tonight. You mentioned a bill and a timeline. The bill was AB 394 regarding the nurse ratio. What does the AB represent? Does it have any significance, or does it just is it just how the government categorizes bills?
Great question. Okay, does anybody want to answer that, or I can answer it? Okay, so the AB and SB do represent a committee. So AB is the Assembly bill and SB is a Senate bill. So depending on where that bill originated, it would get the title A, B, or SB. So if your senator was the individual that initiated that bill, then we would see SB for Senate bill versus AB for Assembly bill. So excellent question. Sometimes, we're bombarded with so many bills that come across that we hear about in either read it in social media or on the news. And perhaps we've often wondered, what does that, I hear AB, SB, what does that really mean? So no, that's where the bill originated. And that's how we're able to keep track of where it originates and the actual number that's on the table. So great question. Thank you.
I see Carolina has a question.
Yes, more a comment. For those that haven't attended our summit, can someone kind of go over the schedule so they can get a better idea what that the summit is all about?
Does anybody want to answer that?
I think the pause was we all wanted to jump in because we get so excited. We get so excited talking about it. But yeah, I'll share my experience. But please, I'd like Wendy and Celine and Michelle to join in as well. So what this is really modeled after is Capitol Hill Days. ONS has Capitol Hill Days in Washington, D.C. I think they're going on 8 or 9 years now. And so if you think about it from the nursing perspective, it's kind of like the first day is your didactic, second day is clinical. So on that first day, what we really want to do, because we get people of all levels, right? People that have gone and visited their legislators before, people that have never done this in their life. In fact, when I went to Capitol Hill Day, I didn't put two and two together and realize that we were going to see our senators the day afterwards. So I was super nervous. But we make it very like the group here shared. We make it a very easy experience. It's as easy as we can possibly make it for you. So the first day is to really just get you excited about advocacy as from the nursing perspective, because politics, government, it touches our lives on so many levels. But I think until people see how it really impacts you directly, that's when you get more involved. So the first day this year, we have ONS presenting. So Heart Health is the policy firm that works with ONS. So we are flying someone in from Washington, D.C. to present to the group. We have ANA California that's also going to be presenting, and they really are own the space and nurse advocacy and health policy in California. So very excited to partner with them again. And then we have other presenters from academia, from nursing organizations that are talking about how they are involved in advocacy. So that's day one. Day two is it's hard to predict it yet until you do join us, because we actually will walk you through getting in touch with your legislator's office and making an appointment. So it's very much a real world exercise. And you get that appointment more often than not, because we're all in California. You won't be the only one in the appointment, because you're going to be with nurses and colleagues from your zip code, basically from your region. So you go as a group. We have bills, specific bills that we're going to advocate for They're oncology focused, of course, because the Oncology Nursing Society. And so everybody has the same script, basically. You can read from it, you hand it to them. But the most important thing is that you're representing yourself as a nurse in California. You have these issues that you want to educate your legislator on and talk about why it's important for you and your patients. So it isn't really so much about reading what's on the paper. It's being there in person as someone that's lived life in the front lines with your patients and talking to them about what you need. So much like what we do to advocate for our patients in the hospital or the clinics, but this is just in a different environment, really, and talking to people that can make real world difference. So I know that Michelle and Celine, I see Precious on here as well. She's also part of our group. So I welcome anybody that's done this in the past to jump in.
I think I would just add that we go in there and we don't have to know all of the policy. We have our stories. Like one year we were advocating for, I think, lymphedema sleeves and, to just tell legislators how important that is to patients. So, don't be intimidated. We do prepare you. And, by that second day, you'll be with a whole group and we're just going to tell our stories.
Yes, and I have to agree with Wendy. It's all about the story and it's all about our voice. Here we are. There's over 4 million nurses in the United States. If we collectively decided on one topic that we wanted to champion, can you imagine how impactful that can be for all the people that we serve, that we take care of? It's just incredible the amount of empowerment that we have, but we need to bring that voice forward and our stories forward before we can even be heard. We need to say it because our governor and all our legislative, they can't read our minds. We need to be able to voice our opinions and let them know what our patients need.
And also adding to that, I just wanted to say that our legislators are part of our community. So they really love hearing the stories of people in the community. So we need to share them and make them aware of these stories.
That's a good call out, Precious, because if you think about it, more than anything, the laws made at the state level will impact us more directly than laws made on the federal level. So I think there's a slight urgency in talking to your local representatives more so than the federal ones, because the laws made this year, they are going to affect us in our communities next year, right? So it's important to get in those spaces and talk to our legislators. I see there's a hand up, Marbelli. I hope I'm pronouncing that correctly.
Oh, yes, you are. Thank you so much. Yeah, I just had a question because I am not a nurse yet. I take my NCLEX in June. If I'm if I'm interested in coming in May, am I able to do so, or I have to wait until my license?
No, you're able to join us. In fact, we've been trying to get students for years to join us. In fact, if you message us, I can send you the information. But the problem with people in school is that they're usually in clinical, so it's hard for them to get away. But if you're able to join us, and if you can share the word, that would be great. And in fact, nursing school is probably the most important place to get these types of skills and know the importance of advocating, because it just serves you so well throughout your career.
Well, I think this was a successful webinar. I hope our members and everyone out there listening found this informative and helpful, and know that, when we can get together and speak as a group, just one or two voices can make such a huge difference and impact our patients' care. And just like what Jelani said, we do this day in and day out in our nursing careers. We advocate for our patients at the direct level of being with the patient side by side. This is an opportunity to go a little bit further and spread our voices to individuals that can make those changes that can impact our entire legislative and federal level. So let's all make it happen. Let's make that next step together.
Thank you, everyone, for attending.
Thank you.
Thank you. Hope to see you in Sacramento.